Hello and welcome to this channel. This week or this month actually we are going to have a series on pregnancy, preparing for pregnancy from conception, pregnancy during the first trimester, the second trimester, the third trimester, and of course we'll talk about delivery. Today we are going to, for this week, we are going to talk about preconception care, and then subsequently we'll be talking about the other stages of pregnancy. This is Dr. Aurora Maranga, consultant gynecologist and also cancer specialist at St.John's Hospital in Nairobi. Now, what's preconception care? Preconception care, here we are talking about the care which one needs to receive or which is available for somebody who is preparing for a conception. And so this usually would make pregnancy or rather fertility to be better, and also for the pregnancy to be better. Now, what do we usually look at when you're looking at preconception care? The medical checks that we usually do when one does come to the hospital, we'd usually look at what's the history like. Then we'll look at, we'll examine the patient or the couple in that particular matter. And then we can do some investigations and also give advice as may be necessary. So we usually look at the history. In the history, we would check on whether there's any significant past medical history of, say, diabetes or hypertension or asthma, or any other condition that may impact negatively in terms of the pregnancy to come. So we look at that, and then of course also we look at if somebody has had a previous history of infertility, has had difficulties in conceiving previously, has had operations before, whether for pregnancy or not. Those would be important preconception. And then after that, we would also look at if there are any other, still in the history, any other possibly genetic issues. If, say, there is a family history of sickle cell disease in the family, that would be important, or Down syndrome in the family, that would also be important. And then we'll examine the patient, look at the general condition of the patient, whether they are anemic or not, whether they are obese or not, what's the body mass index, that's the BMI, whether it's adequate, normal, or whether the patient is obese. Those are important preconception. And of course, we'll also examine the breast, especially if this is somebody who has never breastfed before, has not had any pregnancies before. That will be important, looking at examining the breasts. Of course, the usual way in which we look if there are any abnormalities in the breast, but also checking if one has flat nipples or not, although that will become more important later when they're actually pregnant, whether they have inverted nipples, which would herald that probably after giving birth there might be difficulties in conception, difficulties in breastfeeding. And after that, we'll generally also look at the abdomen, look at whether they have any fibroids or any growths or any distension, visible distensions in the abdomen. And if need be, we would advise the patient to do also a pap smear. That's while we do a vaginal examination, to do a pap smear, which is part of really the general check. Apart from that, we would advise some investigations like an ultrasound scan, where we do check the reproductive organs. We check on the uterus, rule out any fibroids, check on the ovaries, rule out if there are any ovarian cysts or anything which can impact negatively on the pregnancy or any other abnormality. Then the other tests which we carry at that particular point would be screening for infections like HIV, so an HIV test would be important, screening for venereal diseases like syphilis, and also check for hepatitis B especially, because all these are infections which can affect conception and therefore the upcoming pregnancy and therefore the baby. The other tests which would usually recommend and do are the blood group for the mother, especially checking for the rhesus factor, if it's blood group A, B, or O. But more importantly, to check on the rhesus factor. That means if they are rhesus positive or they are rhesus negative, because that has implications, especially if it's rhesus negative on the pregnancy, especially if the partner is also is rhesus positive. So in other words, these are tests which we run for couples, so that if there is any infection, maybe HIV in one of the parties, and remember, it's also possible to have one partner being HIV positive, but the other one being HIV negative. So we do screen both the man and also the woman, of course, so that there is clear advice there of how to manage these conditions pre-conception. Of course, we also do check for the sugars, especially if there is a strong family history of diabetes, and also, of course, we check for hypertension and the like. So these are some of the medical checks. When a couple comes to us, those are the things which would generally do. And thereafter, we'll talk about other aspects of how to prepare for conception, how to keep fit, and generally to keep fertility high and prepare for a good conception and a good, safe pregnancy. Some of the issues which we discuss with the couples when they come to us, of course, after those investigations and the results thereof, is diet, and also need for supplementation to supplement some of the important nutrients. So some of the important nutrients and supplements thereof which are required in this case are folic acid. Folic acid is important because it prevents medically what we call neurotube defects. Neurotube defects are babies who are born with abnormalities of the spinal cord, abnormalities of the head, abnormalities of the spine around the neck with protrusions there. And this usually may cause babies to die inside the mother's womb, or they may come out. They're delivered with abnormalities, with big heads, for example, what you call hydrocephalus, or bumps on the spinal cord. These are defects which can be prevented by a mother taking folic acid supplements, and we advise roughly around 3 months prior to conception. That is good preventive measure. But apart from that, we would usually advise the mothers to take diets which are rich on folic acid, like leafy greens. Whole grains are also a good source of folic acid. Generally speaking, also the other type of diet which is required are whole grains, as I've said, legumes, and of course a lot of fresh fruits, and a lot of hydration. Water, like 8 glasses to 10 glasses per day, that will be required. The other dietary supplementation, but also which we stress in terms of diet, is calcium. Calcium can be found in milk, dairy products like milk, in eggs. Those are important sources of the same. And of course, proteins, especially lean meats and fish and chicken. Those are the white meats. They're actually a good source of amino acids, as we call them, or proteins, generally speaking. So diet-wise, we do discuss with women how to have a good balanced diet. I've just mentioned a few, but it's important to note that a balanced diet is extremely important. The other aspect which would increase fertility, or at least increase the health for fertility and therefore prospects of carrying a healthy baby, preconception, is exercise. We encourage exercise, moderate exercise, not too vigorous, just like we had said in a previous episode. Walking is a good one, and of course exercises and looking at the BMI, the body mass index, so that it's maintained within a reasonable limit, and if possible to reduce weight if one has obesity or is overweight, because overweight and obesity tends to negatively impact on fertility and also on conception, and also even carrying the pregnancy or starting a pregnancy when one is already obese. Of course it happens and we still get good babies, basically with no major complications, but obesity does increase the risks of delayed conception and also complications during a pregnancy. So these are the issues which we look at about the diet, we look about the exercise, and of course reducing stress, being stress-free. It's difficult in this environment, but one has to try to find ways of relaxing, whether it is yoga or whatever makes one to really have a stress-free microenvironment to themselves. That would usually be good. Now, I mentioned earlier about the conditions which are genetic, like Down syndrome, and also for sickle cell disease, or any other which can come out from the history of an individual. You may find in a certain family they have very strong history of diabetes, of sickle cell disease, of Down syndrome, or other abnormalities, birth defects and the like, mental defects and the like. So depending on what is the presentation, we would do investigations towards, or geared towards trying to investigate whether the current couple, they have that particular trait or a risk to carry such a baby. So we do have preconception counseling, especially where one of the parties is either sickler or is a carrier for the same, or you may find both the couple they have sickle cell disease. Now in that particular case, of course, there's a lot of counseling which comes in terms of the preconception. Now the other aspects which we would like to talk about are when should a couple get concerned that they have been trying to conceive and it's not happening. It depends on the age. If somebody is below the age of 35, nothing really to worry until maybe after a year. After a year of trying and there's no conception, then it means most likely there is a problem. That means that year of trying with no protection, of course, with regular intimacy between the couple and no conception at all, then one must really seek medical advice, in which case then we'll try and find out where is the problem, whether it is with the woman or the man, or it may be even in both of them. And most of the time these are treatable causes. If somebody is between the age of 35 and 39 and you've tried for 6 months, 6 months is good enough. If there's no conception within 6 months, then please seek medical advice, see your gynecologist for investigations to find out what is really happening. Because within those 36 to 35, 36 to around 39, 40 years, we don't really have a lot of time in terms of fertility. And of course, above the age of 40, even as you think and even as you plan to have that baby, it will be best to see your doctor so that investigations can be done and proper advice can be given as you prepare for that conception. That's because after the age of 40, fertility tends to go down. Complications tend to be more after the age of 40. So it's best to have that preconception discussion with your doctor. Right, so this has been Dr. Aurora Maranga, gynecologist and specialist, cancer specialist in Nairobi. We've started this series for this week on conception, and today we discuss about preconception care. We have looked at various aspects, and I hope this discussion has been useful to you. Kindly remember to share, subscribe. It may assist also somebody else who may be in need of this. Have a good day and see you next week.